Good morning, everyone. And Martise, I'm ready to go ahead and get started. Thank you.
Thank you. Mara, take it away.
All right, so we've got a pretty full agenda. Happy, and I love to say it pre-Friday. It just makes this day go a little bit better. I hope everybody's having a good start. I hope everyone enjoyed spring weather yesterday. But of course, if you live in Chicago and you live here long enough, you know it changes on a dime. And so we're expecting a winter snowstorm this afternoon. So I'm hoping everybody has already thought about how you're going to keep yourself and everyone safe this afternoon. But with that said, let's go ahead and launch into the agenda this morning. I've got a couple of things I want to cover. And then as always, I'm going to turn it over to team members here to fill you in on some updates. And so the first one I do want to start with, and this link that's in here, actually, if you click on it, once you get the link, you can actually get the slides where OHS, Office of Head Start, and HHS has put together a webinar on vaccines and mask wearing. And so I wanted to just give you something directly from them. And as a reminder, again, and I put it again in letters, federal. I'm going to say it again. This is a federal mandate. The federal mandate and the state mandate are not identical, but the federal mandate is very, very specific. And so for those of you who have federal dollars, you do need to ensure that you are working within your organization to do everything that's being asked of you. And they are asking several things. I'm going to say this, but I put the link here because I really want you to go onto this, pull down those slides so that you have them. Other people in your organization who need them will have them as well. A couple of things that they are requiring. Number one, they are following through with the vaccine mandate effective January 31st. And what they're asking is to ensure that everyone who is in programs funded by Head Start, that staff are being vaccinated. We have updated COPA and we're requiring that people put information into COPA. That's our way of determining whether or not we as a federally funded recipient of Head Start, whether or not it's being followed on the ground. And so we do need you to put those into a system. What they're asking you for though, at your agencies, and I'm saying this because we know we are going to have federal reviews. We are up for an FA2. We expect us to have that sometime this spring and as late as September. With that said, one of the things that they will be asking for is documentation to show that staff have actually been vaccinated. If you're putting this information into COPA, you will have a record at your site of your staff vaccine records. If you have another tracker that you're using offline for you, I still need it in COPA, but if you have another system that you're using, then you will definitely be able to show that to reviewers as well. Again, they are wanting to make sure that we're operating environments that are as safe as possible. We still know that children that we serve, our young children that are birth to 5, and those 5-year-olds, yes, they're eligible, but those children who are still 0 to 4, there's no eligibility for vaccines right now. And what we do know is the best way to keep them safe is having adults around them who've been vaccinated. And so again, I'm wanting to make sure that everybody understands that this is still out there, federally funded programs. This is a requirement. And so we are monitoring. I looked at a record yesterday and I can see a lot of gaps in the system. So we will be coming back to you again, making sure that you're including that information in the COPA data system so that we have a system of record, again, regarding vaccines in our programs. Again, that link on there, if you click on it, you'll be able to get to the slides, have them for yourself, and see exactly what they're asking us to do. A couple of major projects that we here at a Children's Services Division are working on. A on here is a new data system. We will be moving from COPA. We hear you, we've heard you, I've heard the team. I was on the other side using it and have been using it since I've been here. So we are in the process right now of a new data system. And in that new data system, we are hoping that it's going to offer you some new technology that's going to help you. And yes, I see the ask and that's to put it in the chat. Yes, I will, before the end of this, definitely get that link in the chat for you. So yes, we will do that. But the new system of record will be launched in the spring through the fall of this year. We're working to have it up and running in 2022. So we're here now. We've been working with our vendor in creating this new data system. We are going to have trainings and a lot of other things that are going to happen. And a few slides after this, I'm going to walk you through a little bit more information on our approach and what we're doing with the new data system. We're also working directly with CPS and the mayor's office on a new application system. It's going to be on a new platform. As of today, what we are planning to do is move away from the current application that's in the COPA system. And I say as of today, because as we're working on this, what we're attempting to do is to make sure that as we are working forward, that we're looking and making sure that everything's going to be able to launch on time. As you know, we have that application, but we are planning to move away from the current application and into a new application system with a new system. We anticipated launching that application April 19th of 2022. So we're in the process of working on that as we speak. See on here is FA2. I've said it before, I'm going to just repeat it again, that the federal review, that focus area 2 review, we are slated to have this year. The early Head Start expansion sites, there are 5 of you who have been working with you, and I thank you for everyone who participated yesterday for the TNTA session regarding ERSEA to make sure that we are identifying what we need to do in those eligibility records so that we're ready again for the review. What we're doing right now and everything that we're doing, some things we're doing specifically with those 5 agencies, which the TNTA yesterday was specific to them, but we're duplicating that work across all of you that are federally funded so that when you're up, and we know Early Head Start Child Care Partnership is due to be up in 2023, we're going to be able to give you all of this information and work with you and answer your questions as well to make sure that you and your teams feel that you have everything you need for successful FA2 in your house as well. And so we're going to continue to work on this, and we're going to continue to work with you, making sure that we answer your questions and giving you resources and making sure that we see from you what your messaging is. And that's one point that I'm making for all of you, specifically those that are in the FA2 review. One of the things that they're saying is they are looking for our consistent messaging. We, DFSS, we don't directly operate any programs. We fund programs, but we don't directly operate programs. We want to make sure that we're able to carry your message about why you do what you do. Why are you offering in your partner sites or your directly operated sites early Head Start expansion? Why did you elect to be a part of this? What does it mean for you? Does it expand your opportunity in your region community? ... We'll be working with you around your messaging. And the reason I'm asking people to start thinking about that, we know that they're going to do this in a very simplified way. And some of the information that they'll be gathering, we'll be gathering it here at DFSS. And I don't know exactly which questions are going to be fully responded to here at DFSS and which ones you will have an opportunity to respond to there in your house. But what I want to do is make sure that we're consistent and persistent in our messaging. And so want to work with you and talk a little bit more. So for the 5 of you, I've already met with one, we'll be meeting with the others also to talk about messaging and messaging points. And again, it's telling our story. We want to make sure we're telling your story for you if the question is being posed to me or any of my team members. So more to come on that. I put a note in here on good stewards of funding because we have a responsibility to ensure that we are responsibly and effectively using all of our dollars. If everybody could mute, I'm hearing some, thank you, everyone. Again, good stewards of funding. We have a responsibility to make sure that these dollars are responsibly and effectively being used. And right now, and I know we're going to give you updates on where we are, but I'm very concerned. And I just want to say this to all of you across all of our funding streams and the utilization rates that I currently see. We're going to work closely with you to try to understand the why behind this. But again, you know, what we've been asking for and what we're currently asking for is that you work with your staff to ensure that you are getting your invoices and vouchers in the system, which will ping the system and let us see exactly where you are. And when there's no movement, there's a concern. And I know between 2 reports, I've seen no movement of additional invoices. And so I'm speaking to you from this seat, asking you to do everything you can to make sure that you are effectively using all of your dollars. and that you're vouchering at 100%. And if you're not going to be able to do that, we need to hear from you. We need to work with you. I mentioned this before in the meeting that I did with the Early Childhood Block Grant recipients. But one of the things we did is we turned back a lot of money, and we can't be turning money back to our funders and expect our funders to continue to fund us at the same level. And so we've got to do better. And that's what I'm just putting out there. I'm saying again, for those of you who are not going to be able to use your dollars effectively across your programs, we'll be working with you. And if you're not going to be able to expend your dollars, we will work with you to do a reduction, and then we will reallocate funds, because we should not be turning them back. We should be able to get to a point within the program year, in any year, and determine where dollars are not being used, so that we can ensure that they can be used in other ways, because there's a lot of other things that we can be doing on behalf of children and families. Turning back funds is not one of those. And so you'll hear me speaking to this and saying it every time. I know I'm going to probably sound like a broken record, but what I'm trying to do is make sure that we're not getting our grants reduced because we're not using them. I know you're serving children. I know your doors are open. I know you're paying salaries and all these other things are happening. I just need to make sure that I understand the why when people are not able to use all of their dollars. So I will be meeting with you to get a little better understanding of what's going on, and also to see what support we can give. Enrollment. I put a question mark there, and I'm asking that you put some things in the chat for me, and I just saw one come up. I just want to know what kind of issues you're having enrolling, because we're also under enrolled. And if we are going to support you, I need to understand what kinds of things are happening so that I can work with my team and also my vendors to figure out what else we might be able to do on your behalf. And so while you're on this call, if you can just take a few moments and in the chat, give us some ideas and give me some issues that you're having with enrolling families. And we're going to, after this meeting, I'm going to take all of those and compile those and work to see what's going on and how we might be able to come up with some strategies around supporting you. So take some moments while you're here. Please fill up the chat box. Give me some reasons, and I see them popping in. So I thank you. I thank you. I thank you. Continue to do so. I'll need to have these at the end of this meeting. So thanks for taking time to do it while you're on. Next slide. So I said I was going to get into a little bit more detail regarding the new data system. And as I said on that slide previously, we're moving from COPA. We anticipate moving from COPA starting in the spring, with the full implementation by the fall. What that means is we have a lot of work that my team is doing with the vendors to develop and create a new system. But what we're trying to do is make sure that what's within this system answers some of the things that we've all talked about that we want to make sure that we have in this new data system. So the why are we changing? We need to comply with the federal requirements. In order for us to comply with federal requirements, we must procure an innovative technology system to fulfill our charter. We are responsible for ensuring that we're able to capture the correct data on all children served, all agencies funded, in a system that's going to allow us to be able to give the kind of reporting that we need across all of our funding sources. It's been a stretch to get the COPA system to be able to do what's necessary under the Early Childhood Block Grant. We've gotten some parts of it up and going where we are able to get it, but we have not been able to get everything that we've needed in the system. With that said, we're moving away from COPA so that we can get a system built that's going to allow us to do some of what it is we know we really, really need to do in our program data side of our house. The current technology right now is 18 years old. And I want you to just think about it for a moment. How many phones have you bought? How many new phones have come up? How many new computer systems have come up over all of these years when you think of 18 years old? 18 years old. There's been a lot of changes across technology. And so it was time for us to look at our technology and make some decisions about whether or not it can continue to take us forward and moving into the future. Is it going to be the responsive system that we need? We determined that it was not. For that reason, we're building a new one. So what is this new system going to do? It's going to provide a better and more intuitive, a configurable experience that is unique to each user. It's going to allow us to do some configurations that we were not able to do within the COPA system. And that's what we need. We need not just a system that is a screen where you put in information, but we also need to have it be in such a way that it allows us to take that information and move it forward and then change when we need to. Our system, current system, has not allowed us to do that. When we want to do some configurations, sometimes very simple, very small configurations, sometimes it will take us weeks, if not months, to get it done. And we really can afford to do that. When things need to change, they need to change. When we need to shift, we need the capability to shift. Our new system will allow us to be able to do some of that. It's going to improve our data collection and management. And so it's going to be an improvement for you on your side. It's going to then be an improvement on our side. We will be able to get from you the kind of data that we need, and in such a way that we will be able to, on our side and you on yours, to be able to manage that data. It's going to facilitate some automation for some things that we want to do. I know you've been in receiving funding from us for a while. We got a lot of forms, people. We have a lot of forms. And what we want to do is make sure that some of those things are able to be accessed directly within the system, and actually in many cases fillable within the system. So we're working on some of that as well. But we also want to make sure that it's the latest innovation and the best practice for our future consideration. And so when you're building a system, it's not just being built for today, but we're trying to look forward and trying to see what kind of future things that we need to be thinking about. And those kinds of things are being built intuitively into the system now, but it also leaves us the opportunity as we move forward to do some of the changes that we know what we want to do as things change around us. We just need a system that is much more flexible. That's what we're building, and that's what we plan to launch. Next slide. And so the new data system that we're moving to, we need to work together. We want this change to be proactive. We want to listen to you. We want to gather information from you, because we want to build a system that benefits all of us, both on your side and ours. We have a responsibility to make sure that everything that we do is responsive and allows us to support the children and the families that we serve here in Chicago. That includes our data system. And so we need to work together and make sure that we do that. Yes, the system is COPA informed. And let me say what I mean by COPA informed. We know what we've been using is the basis for what could we do better. So it's informing us. It gives us an insight into some of the things that we know we're not working the way we needed to work. And so we've been able to use some of that to build it out so that it then is responsive and it's built in the way that we know we need to be able to use it on our side, and then thinking about some of the things that you needed on your side. And so COPA informed, yes, not a mimic of COPA, but COPA informed, in that we also know that our data system has to be responsive enough for us to create that PIR at the end of the year. And so having a system that had already been set up, allowing us to do that, we needed to make sure we were creating one that allows us to continue to do all of the things that we need to do for all of our funders, both federal and state. We've dedicated some time to organizational change management and some training, and we're going to be talking to you more about that. We want to make sure that we think about this as change management, and this is change. Everybody does not receive change the exact same way. Some people are really okay with an 18-year-old system being here and then sitting in a meeting and saying we've had it for 25 years because they really don't want change. What we're looking towards is the future. What we want is something better, more intuitive. And so we need all of us to be able to talk about what this is going to do better for all of us. And we're going to work with you on messaging that there at your sites as we're working on it here. Our vendors are going to work with us and work with you on being able to do that. But one of the things we want to do is make sure that you see yourselves as actively involved in this transition, because you need to drive change in your organizations, and we want to help you be able to drive that change. So we will be working with you actively in that process. And we're going to be able to make sure that we are providing information for you on change management, communicating this and talking about direct systems and direct channels that you'll have. But know that we have a project team that's working with us that's supporting us currently through this, and we'll be supporting you all the way through training. So one thing, and if you're thinking about it and it's in your head, I want to answer your question right now. Will we have both systems actively working at the exact same time? My answer to you is yes. We will be standing up this system before we turn off COPA. We will be wanting to make sure that you and your teams are able to actively work within this system before we turn COPA off. So we will have both running at the same time, but we'll be working with you on that. While you're trained on the new system, you will be actually able to still put your data into COPA, and we're going to migrate all that data over. So yes, there will be a period of time where both of those systems will be actively running through the DFSS system. So wanted to answer that question. I know it's in the minds of people. Just wanted to put that out there. Next slide, please. And so one of the things that we're working with our team, when you stand up a new system, you get to name it. And so we're working with my team here, DFSS, giving them an opportunity. This is their system. Yes, you work with it, but we're giving them some ideas on a name. What we have not come up with the new name, Jackie, we're working on that. And so they've been able to give us their voice. I'm going to pull down everything that's been given to us. I'm going to go through it, see where there's duplicates. We know that there's some great thoughts out there. You got some that are a little funny, like garbage in, garbage out. We know if you've got a data system, it really implies, still the human side of that and who's putting what in. And so there's some great names that I've seen that have come from staff, and we're going to be sharing that as we move forward. But we get to do that, and that's an opportunity that we're taking seriously here with our team, is to really come up with something that's the name of this new system and the system that we know we're going to be taking into the future here at DFSS. We're going to want to develop an easy access team site, a place where you'll be able to go externally and come into it and get information. Some of that information that you'll be getting is on the other side of the slide, and I'm going to talk about that in a second. But we want to support all of our stakeholders in this process. And so we want to give you a place where you can come in and out and see what's going on, get your questions answered, understand, and see when the trainings are, who needs to be in what training as we plan forward for everything that we're going to be doing over the next few months. And we will be planning some additional meetings that are change related, and we want to answer your questions. What else do we need? What are the changes that you see? Are we on task and on target with all of the messaging that we need to have out there in order for us to get this done? And so Cindy, I see your question. I'm going to answer that one in a moment regarding what platforms. But again, one of the things that I want you to know is this is not a one and done. We're going to be working with you over the months. Some of the things that we're going to do is give you a leading change guide to give you some tools and some words and things that you can use within your staff meetings to talk more about this new data system, because we're not there with you, but we understand that your staff will be using it and they're going to have questions. So we want to give you some tools to help you be able to respond to that. Messaging, we want to give you some of the messaging that we're using that's going to help you on your side to talk to your folks about what's going on. There will be frequently asked questions that we will be getting out to you so that you're able to answer and respond to some of those questions as well. You'll be getting slides and all kinds of communications as we go forward. Some of the things that I want you to think about is training. And we've got a group of folks that are working with us, and we're going to give you some points of contact on who's going to be working with you on training as we are moving forward. You'll get some quick reference guides. Those guides will help you in understanding the system and the different aspects of the system. You'll get a user manual. Right now, you've got COPA. If you need to get into COPA, you can get into certain places, but you're going to get a user manual on this system, and then some job aids. And all of these things are being created by the vendors that we're working with. And so I did see Cindy's question in the chat and wanting to know what platform. We're working with Salesforce on the creation of this new data system. Next slide. And so a lot of information is out there. I know people have been asking, what are we doing? This team is crazy busy. And when you have a team such as I have right now, where we've reduced staff, but we didn't reduce the work, I just want to ask all of you to please, I know you need things from us here at DFSS. And if we're not as, emergent responders, meaning that immediately responding to you, sometimes it's because some of these teams are literally on 3 or 4 calls a day, working on building out this new system and also working on the application system. They are swamped right now. I'm saying that on behalf of all of my team. I too am swamped. But I just want you to know that we're doing everything we can to push all of these projects forward, and heavy lifting on our side where we can, so that we're not pushing so much down to you, is what our team is working on right now. And so just need you to understand, if somebody doesn't get right back to you, they may actually be in a 3-hour meeting. Some of the meetings, in order for us to do this, are very, very long. And then sometimes they literally click off of that one. Technology allows us in this world to click from one meeting to another instantaneously. And that's what everybody believes we should be able to do. So from moment to moment, they literally are in meetings from the time they sit down at their desks until the end of the day. It's a heavy lift, trying to create a whole new system for what it is that we're doing with our Head Start, early Head Start funds, with our state funding, early childhood block grant. And in addition, we also have child care assistance program. And so all of that's being embedded in this new system. So this is really a heavy lift, and we're working on it. And so I'm just asking you, if they don't get right back to you, know that they will get back to you. Same thing for me. I'm doing everything that I can to, and I've got 2 screens, one that shows me my email right now to make sure I know if there's something urgently coming through as I'm talking to you on the other screen. And so we're working on it. And we will be coming back to you with a lot more information about all of the projects that we're handling right now. So I'm going to thank you for listening to my voice. And I am now going to turn this over to the next person who's going to talk to you about enrollment. And again, I mentioned enrollment. I see things coming up. Thank you, thank you, thank you for all your responses in the chat regarding enrollment. Who am I turning it over to? Nobody chiming in. I can say what the Head Start, the enrollment is. It's right here on the screen for you. Our Head Start, we're at 89%. Our early Head Start, we're at 76%. PFA, we're only at 69%, so we're really down. I know, and there's reasons, and so I'm asking you about it. You're putting it in the chat. I'm going to be pulling that down. There's been movement. I'm not saying that we have not moved. I just want to remind you that for the child care assistance program, you are able to enroll parents in your funding stream. I know we want that other funding attached to children. Parents who are not employed right now or not attached to an activity, that opportunity to enroll them in your program, get them onto a funded one here that's listed here. Work with that parent to get them into school or back in school if that's what they were doing. Working with them to get back employed again. The thing that we know is mom can't find a job if she's got her children in tow. And so that's an opportunity for you to work with parents who really want to be back connected to our world through employment, but are struggling to try to figure out how to do this. One of the things that I'm working with a couple of other organizations who are looking at and saying, for example, in the homeless community, and those individual agencies that are working with parents who are suffering through domestic violence, we're working with them to try to figure out what information we can get to them, to those providers, so that they can talk to the individuals who are parents that they're serving, so that they understand that this is an opportunity for them to get their children enrolled in programs. And so I'm working on my side to get some information out there to try to get some more parents understanding what it is, they understand that there's childcare, they don't understand how to enroll. And so we're putting together some message points to help them be able to speak to that so that we can get more parents out there in your sites being served by you, so that mom can go back to school, do what she needs to do. And if she needs to be the recipient of services herself, in order for her to do that, she needs her child in care. So we're working on various partnerships to find out where we might be able to go and get information out there to get more parents engaged in our program. So I'm working on that on my side, and more information to come on that. Next slide. B, I'm turning it over to you.
Thank you, Srapel. Just a couple of updates this morning in health and safety. And we'll begin with Angela Hughes. Angie.
Good morning, everyone. I'm just going to share a couple of updates with you really quickly. As a result of the 2021-2022 school year, The hearing and vision team has conducted 271 visits out to various sites. In the process of doing that, we have conducted 2,497 screens. Initially, we have issued 47 hearing and vision hearing referrals and 182 referrals for vision. And these referrals should be for further assessments to the doctor. The technician will continue to follow up with your agencies on referrals issued. Also, the technicians are reviewing agencies and reaching out to sites to schedule additional screenings for children who are newly enrolled and children needing follow-up. Just as a note, please be mindful to update COPA with the most current results of all screenings conducted. Thank you, and I pass it back to you, B.
Thank you, Angie. And facilities update, Jeff.
Good morning, everyone. Just a quick note from the world of licensing. Previously, as you guys know, the Department of Business Affairs, the department that handles all City of Chicago business licensing, was closed to the public and handling everything online, which caused a terrific bottleneck in the processing of new applications, license renewals, inspections, etc. They have recently asked me to inform all licensees that I assist that they are now open to the public again. They are encouraging everyone, if you have any new site that you're opening, if you are making any changes to your licensure, such as change of officers, change of location, change of business name or legal name, to actually come into the offices to initiate that process and carry it through. It'll be very much to your advantage to do so. I know not everyone likes to take that trip down to City Hall, but it will save you literally weeks of waiting for them to do that online as opposed to doing it in person. So do take that trip down there. They're ready and willing to see you guys again. They're happy to see you, and they'll get you processed much more quickly. I will put in the chat box the address and phone number for Business Affairs, and you can have that. If you have any other questions, I'll also have my number there also. B?
Thank you, Jeff. For our federal Head Start programs, there is a new DFSS release for an RFP that will provide bus evacuation drills. We're hoping to award one contract for these bus evacuation drills. So this will be given to one provider. They're going to provide you with the 3 required drills, and closing date for the submission of the proposals is March 25th, which means that we're going to do a really quick turnaround and try to get this awarded in the beginning of April. So that's something that is coming your way, and we'll provide more updates with that as it goes along. And then last update, I'm going to turn it over to Gina for disabilities.
Thank you, B. Just a brief update for our disabilities content area. First, I'd like to share the Chicago Public Schools highlights with you. First of all, our citywide special education assessment team is operating in a hybrid setting. And so what that means is that we are offering families in-person evaluations for their children, and we are also continuing to offer virtual or remote evaluations due to COVID. And so it's interesting to see that we have shifted now. And we do have more families opting for in-person evaluations. To talk with parents, they'll let you know that they really do want the team to see their child in person. They feel strongly that if their child's going to be assessed, they want them to see the child in person. And so we are offering remote options as well. It is still hybrid, meaning that it's not everyone back in buildings. And so for your staff, we're still inviting them to participate virtually. So even though one child, one parent are coming in person to our citywide assessment centers, all of our Chicago early learning teachers and staff participate virtually. So we will email you a Google Meeting link, and that is the way in which your teachers and staff are participating. but that's going very well. We are offering Saturday assessments for families who are interested. We do offer one per month. And so the next Saturday assessment will be on February 26th. I would say we have about 10% of families who are electing to have a Saturday assessment. The good news is we are back to offering in-person Saturday assessments at our Garfield Park location only. So if families are willing to come to Madison and Western on a Saturday at 8:30 or noon, we can see them in person. So that's a nice option for families as they're working. And we do have some children scheduled already for Saturday, February 26th. Regarding school assignments, during COVID, a lot of the school assignments shifted from being mailed, with letters to families at home, to being electronically sent via parents' email. And so the good news is now we're back to sending school assignments to families in both modalities. So we will email it to the families, and we will also be mailing it via US mail. So this is going to help ensure that the families receive that timely school assignment. If families are not receiving their special education school assignment up to 2 weeks after their child's evaluation, we ask them to reach out to our disability subject matter experts, because we definitely want to ensure that we have that child placed in a timely manner. And I would recommend that you contact your disability subject matter expert if that's the case. Some of you did note in the chat the challenges of transportation at this time, and particularly Chicago Public Schools is heavily impacted by this, along with the national shortage. And so if you have children in your programs with IEPs, IFSPs, more IEPs, and they're not receiving transportation to services, we encourage your programs to reach out to our disabilities subject matter experts. We want to ensure that every child who is eligible and whose parent consents to those services actually does receive those services. And so we're here to help you troubleshoot any of those issues. I know we talked last time about a stipend that might be available for families. And so if there's questions about that, we can assist in that area as well. And then finally, just a few more points. We want to encourage you to continue entering your children's IFSPs and IEPs into COPA, because what we know is that every IEP and IFSP counts towards our 10% federal mandate of disabilities enrollment. The great news is that for Head Start, we are exceeding 10% disabilities enrollment for our children. We're actually at 11 plus. That's great news. We want to continue to, all of you to keep up the great work. And also for your programs to continue to send your suspected children's referral packets to our subject matter experts. We are scheduling referral packets we received in December now into the month of March. And so we know by law, the district has 60 school days to complete the evaluation. Sometimes that works out to 2 or 3 calendar months. And so the sooner we receive the child's packet, the sooner that child will be evaluated. So we want to encourage you to submit those to us. And my last update for today is the Resource Center for Autism and Developmental Delays. I know I think I share that on every call, but I would like you to be aware that it's a wonderful free resource for our families. They have wonderful workshops for your teachers, your staff, your families, guardians, about including children with disabilities, supports at home, how to deal with challenging behaviors, how to deal with medical visits. Some of our children might have anxiety related to that and not participate, so it may impact compliance in that area. And so if you're not familiar with RCAD, we can definitely get some information out to you, right, Bea?
Absolutely, Gina.
Okay.
We do have a couple of questions in the chat. Gina Scott wants to know the percentage of children who are receiving disabilities. And then Linda is sharing a really great story about a child that CPS helped with who has gotten picked up from a taxi, and they sent the aide in the taxi with the child. So do you have those statistics for percentages?
Yes, I can tell you, thank you for the questions, B, Scott, Linda. I can tell you that at our last check and what's entered into COPA, and again, it's prone to human error, but what our programs are entering is that we're at about 60% of children who are currently receiving their special education services. And so, of course, this is a concern to all of us. And we recognize that COVID is a concern. We recognize transportation is a concern. And so all the more reason for us to redouble our efforts to support these children and families. I do want to make mention, Linda, if I might, that we are in conversation with DFSS and CPS related to transportation modes for our children, particularly as it relates to our Head Start students. Reason being, some have expressed concerns that the vehicles CPS is sending, such as Uber ride shares or flash cabs, may not meet the transportation performance standards in terms of the vehicle's standards for safety, for the number of passengers transported, whether or not the vehicle has like a backup alerting system. I don't know, do you want to speak more to that?
No, I think you're absolutely right. There are requirements for our Head Start children that need to be made. I think we have to bring that to ODLSS and work with them around how we can make this safe for those children. But remember, this is on the CPS LEA side. So we'll do all that we can to make sure that they know what those standards are. And then there are a couple of other questions, but we can answer in the chat.
Great. Thank you, Bea.
Thank you, Gina. Jeff, there was one question about local offices. Are they able to visit the local offices for licensing?
Business Affairs does have local offices, but I have to find out if they have full licensure services there. Some things I know in the past were not being done at the satellite offices for licensure, such as application processing and that sort of thing. Normally, the satellite offices were used for license renewal because that's a very simple process. But I'll find out if the satellite offices are now handling anything else with licensure.
Okay, thank you, Jeff. And thank you for the questions. We're going to go to the next slide. Quality. Will?
Thank you so much, Bea. Good morning, partners in Chicago in our early learning programs. Few updates from our quality unit here. Our scholarships program, I saw a lot of mentions in our chat as it relates to our scholarship. Across the city, and a lot of our partners also had mentioned the lacking workforce. The scholarship is indeed there as a solution to solve our workforce problem. And so, it mentioned in scholarship today, I definitely want to let it be known that our application period was open in January and now closes on tomorrow on February 18th. As it relates to our individual scholars achieving those Pell licensures and are upping in their credentials, it is a win-win for our Chicago early learning umbrella, so to speak. And so one of the things that I do want to encourage us to do is continue to encourage our staff and our teachers and our support staff in acquiring the scholarship program for our family support credentials, our ECE credentials, our IT credentials, as well as those BAs and degrees as it relates to the scholarship. So again, I know Tamela is on. Perfect. Thank you, Tamela. She's already posted it in the chat. So if you could go ahead and access that link to get more information about our scholarship program as it relates to building and sustaining our workforce and reaching our 2024 credential requirements. As it relates to our COPA program, I know Sareto and our team talked a lot about moving from COPA in the spring and the full rollout for the fall, but we are still in COPA now. And so right now we're still using COPA as our data system, and there's some things we need to pull from the COPA data system as it relates to our child and family data. Our team has been working closely with a lot of our partners across the city, and we thank you for reaching out as we're able to provide that one-on-one technical assistance and that support in entering those children with that required information as it relates to those programs and those different funding sources that those children do qualify for. Again, remember with the staff, it comes those professional development plans. We did an assessment recently on our federally funded partners, And again, some of the things that we're seeing is that our professional development plans are not being updated annually. If you can refer back to our sales 2.0, the professional development plans is something that we need to have all our staff have it uploaded and entered into our COPA system annually, as it relates to professional development, as it relates to trainings, as it relates to acquiring new skills, and as it relates to acquiring those degrees for those individuals who do not currently have and possess those. So again, professional development plans are very important. It helps us almost with our continuous quality improvement plan. We want to talk about making sure that our children have high quality education and are involved in our in classrooms with our teachers that are qualified and receiving that ongoing training. So the professional development plans help us really guide and monitor and promote the trainings that's needed. And we use the professional development plans to guide our trainings. A lot of the work that we do comes from the professional development plans, as we know the work and the needs of our staff from your agencies. And so it's important that we have those to really refer to, so we can plan a succinct and a TNTA plan, that's training and technical assistant plan for our agencies. Wanted to kind of touch on assessments. We are still in the midst of the pandemic. We all know that. And so we will be conducting our virtual class assessments again this year. A lot of our agencies have already received outreach and have already secured their windows of observations. If you have not, please kind of keep an eye out for an email from our partners, National Louis University, who conduct those virtual observations. One of the things we will be doing with the environmental rating scale, that's ITERs and ECHRs, is we will be providing books and the tools necessary for you to conduct a self-assessment. It's important that we still assess our environments in our classrooms. And while we are, again, still in the middle of the pandemic, we're not yet there where we allow individuals to come in and kind of assess your environment. So what the best first step in this process will be to allow you as the team leaders, leaders of sites, education coordinators, as well as teachers in the classrooms, to do self-assessments on your classrooms using the environmental rating scales, ITERs or ECHRs. And so we'll be using that information to really gauge our starting point. And then when we can get the go ahead to have our assessors come into your classrooms, we'll be doing official ITERs and ECHRs assessments of your classrooms. So please look out for more information as it relates to your number of classrooms. We'll be sending that equipment and those materials out shortly for that ITERs and ECHRs piece. For our trainings, I want to shoot out a reminder. All participants must register for our trainings via the COPA system. We're finding that right now, a lot of our participants are not registering via COPA, so therefore they're not being admitted into a lot of our training courses and opportunities that's available. So again, it's very important that we use that COPA system to allow registration, unless it is directed otherwise. Again, Teachstone, I understand we do have our own landing page as it relates to Teachstone. And so Tamela will pop that in as well. And these Teachstone trainings live within a different portal. And also those are TSG, but again, the majority of those trainings live within our COPA system. But if there's anything that lives outside the COPA system, there is an explicit message saying to register here via this link that's outside of our COPA system. And that just helps us to really track the participants and then the framework or the tracks in which you guys are, your teachers or our support staff are on as it relates to class observations, certifications and primers, foundation, methods as it relates to PAT. So there's lots of training levels that we have here that we want to make sure that all of our partners and sub-recipients are able to access. And so I do understand that there comes a point in time in which our partners are saying that they cannot access COPA. And in that, I want to say, please, as Tiffany mentioned in the chat earlier though, please, if you cannot access COPA, please issue a ticket through the COPA system. That ticket will really allow us to really work with you in ensuring you have the capability to access your necessary portals as it relates to our COPA system. That wraps it up for me. I do see a few items in the chat we will respond to. Thank you all, and I'll go ahead and Mario, if we can progress to the next slide, please.
Good morning, everybody, and happy Thursday. So I just want to give you a couple of reminders across your systems. We've talked a lot about data changes, but I want to talk about making sure that with your respective content areas, make sure that you're working with your staff or monitoring your staff to ensure that these elements are entered timely and accurately. And we ask that you refer to the Sales 2.0 and the milestones as it relates to these content area COPA data entry requirements. Now, this is a requirement for all of our Chicago early learning programs, right? To enter enrollment, attendance, family services, engagement, activities, health services, and your staff HR files. I want to specifically speak to our Head Start agencies to make sure that your staff is completing this information as well. I know that we are early on in the program year, but we will be at the end of the program year before we know it, where our PIR data will need to be generated, right? And so we want to make sure that you are entering that information and that your staff is entering that information in a timely manner so that we can have consistent and accurate data so that when we get to the end of the program year, starting with the end in mind, that PIR data will not require a lot of follow-up on the back end, even as we are beginning to, or will begin to transition into a new data platform. As it relates to communication, just want to make sure that you are informing and reminding your parents and your families in a timely manner of any unexpected closures, and make sure that you are maintaining documentation of those closures. I know that we've had some bad weather. I know that we've been impacted by COVID, but just to make sure you communicate that information with your families, because a lot of that communication with your families will help to prevent information moving up the chain, as you may have heard Sarethel say in previous meetings. We don't want this information going up to HHS. So make sure that you are clearly and effectively communicating with your families, as well as with your program governance with your parent and policy committee members, right? Make sure that you have a system of communication for sharing reports to the board and to the policy committee. And this is specifically for our Head Start programs only, right? So making sure that you have that system in place, making sure that they are receiving those monthly reports, making sure that your system is written out, and making sure that they have an understanding of what your complaint procedure is as well. As it relates to human resources, we want you to revisit the standard of conduct with your staff and ensure that new hires have an acknowledgement form on file. So we always want to keep this at the forefront. We don't want this to slip between the cracks, because this has been a deficiency for us that has been corrected, but we want to keep it on your radar that you make sure that your staff are reminded of the standards of conduct for your program. Last week, we did send out a resource tip sheet about entering staff into COPA HR. But what's not on that document, next slide, please, is the elements as it relates to COVID. And so we are requesting and requiring that all of our agencies enter their COVID data, their staff's COVID data into the COPA HR record. As Sarethel indicated earlier, those fields have been updated. The fields capture the staff's first and second and the booster vaccinations and the type of vaccination that staff has received. And it also captures the type of exemption that the staff may have received, and if there's an expiration date or the date that that exemption was received. DFSS, we will monitor the health and safety compliance of this accordingly, the same way that we do the health file, and the way we look at TBs and physicals, making sure that they are updated. We will monitor that in the same way. We are asking you that you have a tracking system in place to assess and determine who in your program has been vaccinated, who has been partially vaccinated, and who has an exemption and what type. And you should also have a weekly testing log and testing procedures as applicable for those staff who are exempt from receiving the vaccine. We do encourage you to look at the slides that Sareka referenced early on, because the Office of Head Start provides some best practices on templates, policies and procedures as it relates to implementing the vaccine and masking procedures. And so you should utilize those resources to enhance your existing policies and procedures as it relates to the health and safety of your staff and for vaccinations, and particularly the COVID vaccination requirements. DFSS, we are monitoring your programs. We're monitoring your programs internally from our desk here. We're utilizing COPA, any documentation we may request from you, and we're conducting any follow-up by phone or by email. And so we are asking you to make sure that you are implementing your internal monitoring process to ensure the accuracy of data, services, and supports for your children and families in your respective programs. I will now turn it over to Nicole Roberts.
Hi, everyone. Good morning. I'll be going over the expenditure rates and then finance updates. So for FY22, Head Start and Early Head Start, also CCP and expansion, the expenditures are minimal, so it's rounding down, they're less than 1%. It's rounding down to 0%. All contracts, with the exception of 14, have been approved. So 14 of 76 contracts with the December 1st start dates are approved. Your accountants should have reached out regarding invoice submission. So if you have not received an update on your approved budget, please reach out. Next slide, please. For ECBG and childcare, we are currently at 25% expended, and which is very low at this time. We're almost 7 months through the program, and all invoices should be submitted through at least January 31st for these grants. For the FY21 closeout, invoices were due for all of those contracts. If you have any outstanding issues, any invoices that may have been missed, please make sure to reach out to your accountant no later than tomorrow, and we can assist you with working with the comptroller's office to allow an exception to get that invoice in. You will not be able to submit any budget revisions for that period, so the invoices would have to be based on your current approved budgets. For FY22, all December 1st start budgets are approved, with the exception of the 14, as I mentioned, which the comptroller's office has indicated that they anticipate approving those by the end of day today. So you can check your iSupplier or keep an eye out for an update from your accountant. And your accountant will also reach out regarding the December 2021 invoice. We hope to have those all submitted no later than February 28th at the very latest. So please have your invoices ready for submission as your POs are approved. Next slide. For childcare and PI/PFA, all 2021 invoices should have been submitted. Your accountants are reaching out concerning any potential accruals that will need to be reported to the comptroller's office for any exceptions. If you are aware of any issues that have not already been communicated, please reach out to your accountant no later than tomorrow. And here's the link again to iSupplier reference materials, and then all of your finance contacts based on the program. Please let me know if you have any questions at all. Thank you.
Thanks, everyone. I've been following chat. I will say that, and I thank you, Stacy. She's already pulled down all of the comments regarding enrollment and is gathering that for me so that we will be able to look at it and see. I can see some of your comments, and some of what's being stated are income issues with families being over income. I still see the comments about the fact that teachers are finishing their programs, getting their Pell and leaving. I'm going to ask those of you who are giving us information specifically about teachers who have left you, if you can send me an email giving me a little bit more information on what has occurred. Because again, we want to make sure, and we're funding these scholarships. We want everyone to go back. We want everyone to go and get their Pels. We want people who have their AAs to get their BAs, and we're putting the scholarship dollar out there. And so just so I'm able to communicate better back to CPS about what it is that you're seeing on your side. If those of you who are seeing that as an impact, again, if you can send me an email giving me more information on what's occurring so that I can be your voice. I thank you for that. Enrollment, and we know we're still in COVID. I will say, every day I look to see what the numbers are like, but we all know that we are in COVID. We know that we've not gotten on the other side of this. Therefore, we should still be mitigating, for example, in our programs, meaning, the constant hand washing, the cleaning, sanitizing, all the things that you do, including wearing masks, and now making sure that, the vaccine status of your staff if they're in buildings with you. All of those things are necessary in order for us to get on the other side of this and be able to, and I won't say go back to normal, because I don't think we're ever going to go to what we all considered normal. I think we're going to have a new normal that we will live in going forward. I know there's been multiple strains of flu, and you go in and you get a flu vaccine, and it, is good for this variant of flu, and not so much for the next variant of flu. Well, same thing with COVID. And so we're here now. There is a stealth variant of the current one that's out there. And so it keeps changing. It's doing everything that it can to survive while you're doing everything you can to survive. And I just ask you to stay the course. We're expecting, as I'm sure you all had heard, about the vaccine for younger children. It's on hold right now. I know that there'll be some movement on that. We don't know at what point in the year that might occur. So again, just remember to continue to do everything that you're doing in your programs, keeping yourself and everyone else safe, and making sure that families understand why and what everything that you're doing. I see some of the pieces in the chat that when you've had to close classrooms due to COVID in your programs, that some parents have elected to leave. And I see that. I know those are the kinds of things that you're going through. But in closing, necessitated by positive COVID in order to make sure everyone is safe is something that we've had to do. And we've been communicating that to our funders on what it is that you're having to do and the why and the rationale, so that if they're hearing it, they already understand these are things that are happening on the ground here. I just want to make sure that what I'm saying to you is this: we know what you're going through out there. We're not in your program every day, but we do understand the struggles that you're having out there, and we're doing everything on our side of this to come up with ways to help you. As Elaine just talked about, and making sure that we have the information on COVID in our system. Again, this is for federal funded programs. There is that piece in the mandate where if staff are not vaccinated, that they shouldn't be in your program. It will state in those slides when you see them, for example, when you're hiring a staff, that you need to be asking whether or not those staff are currently vaccinated. And if you're planning to put them on your Head Start grant, you should not be hiring someone who is not, because we are past January 31st with that mandate. And so until something changes that says that's not required, And I don't have anything in my house for the federal funded programs to say that we don't do this. We have to. And so make sure that you're following through and updating and putting that information in. In addition, make sure that you're having trackers on your side so that you can document all the points that Elaine went over for you. The slides will assist you as well. But no, these are not our mandates, meaning me, Rachel Burgess Burnett. These are federal mandates and we have to follow them because we've accepted these federal dollars. And so we will continue to work with you as much as we can. I'm now trying to turn my attention to some of the chats that I see. So there's a parent who is her child's being transported for services and says that the parent, that they've got the same driver and the same aide. That's a great way to do it because safety is something that parents are looking for, and also trust, and being able to have that same person come and pick up, and having that same person, meaning the aide there with them, makes it consistent, and we need that kind of practice happening. I'm just trying to read a couple of others. Do we have reputable vendors that can come on site to conduct COVID-19 testing? I will tell you that I can only give you what is being, the list that I have that the city of Chicago uses. I will say that some programs have some COVID-19, and if there's someone who can share that to everyone, here in the chat right now, someone is asking for vendors who can conduct on-site COVID-19 testing. So if anybody is using a vendor at your sites, and I know some of you are, if you don't mind sharing, if you can put that in the chat for your peers so that they can have access to that information. They did shield testing, Cindy said. They tested 98 staff and students, 0 positive cases. That was great news. Things are slowing down. Cindy, thanks for putting that in the chat. I'm always looking for some good news. So thank you. Again, I want to believe, and everybody wants to see, and thanks Cindy for putting that in there. And anyone else, City Lab is in there for you. So please look at the chat. Those of you who have questions about testing, and your peers are sharing some information for you right now. That's what we're here for. This is a community of folks, all of us. We're here to help each other. We're here to talk about what it is that we know what's working, share it with your peers. We're trying to give you information as consistently as we possibly can. Please pay attention to our CSD updates. Every time we're getting information that is value for you, we're putting it out there. Make sure that if there's someone who you feel needs to get it and who is not getting information from the updates, please let us know so those names can be added to the list to make sure that they're getting them as well. Elaine, I saw your hand up.
Well, I was getting ready to type into the chat box, but thank you for acknowledging me. I just wanted to say that for our Head Start programs, our federally funded programs, when you look into those slides that Sarito referenced this morning, earlier today, the Office of Head Start is granting recipients access to testing for staff, and that's through Operation Expanded Testing, OPET. And some of our childcare programs across the country are using this resource to test their children and staff on site. So make sure you look for that in the PowerPoint presentation Sarito sent earlier, and that's for our federally funded programs.
Thanks, Elaine. William, I'm going to ask you this one out. I sent you an email. The question was about PD plans, asking whether or not if there's a specific PD plan that you're asking agencies to use and upload into COPA. If you can respond to that in the chat box for me, that would be great. Thanks, William. I'm trying to see if we have any other questions or anything else coming through the chat. If there's a question that someone wants to, ask openly, as always, you can unmute yourself and throw that one out there to us. Linda is asking, are any CBOs implementing test to stay? And if she's saying, if so, is it working? Linda is responding, we test weekly and inform parents so that they know if they need to quarantine. So some people are using tests to stay. Going back through the chat quickly, I don't hear or see anyone unmuting. Know that, again, as I mentioned, we have, Stacy has taken down your comments regarding challenges and issues you're having with enrollment. And I will be taking that information and using it and trying to look to see what kinds of consistent messages there are so that we can see, are there some strategies and things that we might be able to do on our side to assist, because we're here to help. We're partnering with you in this and want to come up with different strategies and ideas. So I thank you for everything that's been put in the chat. That's going to be really helpful as I'm discussing with my staff and also communications back to funders. So I'm going to hesitate to see if there are any additional questions or comments, if anybody wants to unmute before I give you some time back in your day today. Hearing none, I am going to thank everyone for spending time with us today. We are always only a click away, meaning you got our email addresses, our phone numbers, and I'm putting my email address in for everyone, just in case there's anyone who doesn't have mine. So that you understand that you can always reach me as well. If there's anything that is needed from me, I am available. I am in meetings all the time, as well as you, and doing everything that I can to be as responsive. And I have my assistant who also is reviewing my email address, my email box at the same time, in case I'm missing anything. And so everyone, please, please know we're here. This is a partnership. We're here with you. We're here to help you. We're here to strategize with you. We're all hoping and we're looking forward to life after COVID. I don't know when that'll happen. I never thought we'd be here today, but we are. So everybody still stay the course, continue to do what you're doing to keep yourself and everybody in your work house and your personal house safe. Please be safe this afternoon. As we know, we are under a winter weather alert and we're anticipating snow. Again, we're in Chicago, we get snow. Some people are going to get more than others, but I'm just asking everybody, please stay safe. Stay safe, be healthy, and we'll talk to you soon. And again, I thank you for everything you do every day. Have a great one, everyone.